I kind of want to get a pharmacist's point of view. What's your perspective on what has to happen in the healthcare system or even in the community to improve the health of the population?
I think everybody has to get involved, whether it's private sector, public sector, whether it's government, whether it's the patient themselves. They need to all work together to not only help that particular patient, but also have certain programs that help the community toward a healthier community.
Half a day, Guam and beyond. Welcome to another episode of New Gen Peak Performance. So today we have Karen Song with us today. So she has been a graduate in 1986 at our local Academy of Our Lady of Guam. She attended UC Berkeley for undergraduate studies, and she's an alum of Creighton University School of Pharmacy and has been practicing community pharmacy with direct patient care in Guam for over 30 years. She's currently a pharmacist in charge at Superdrug's Oka location in Tamuning, with leading efforts to advance clinical services by keeping up with APHA national immunization certifications, travel health pharmacy certification, medication therapy management programs, and CDC-guided training to CHWs or community healthcare workers. She's also previously worked at GMH for 9 years as a hospital staff pharmacist, and she is an active member and in the community, helping in DYA among many community outreach efforts. And it'll take me a long time to go through this whole bio because you've done so much. But as a person, if you don't know who Karen Song is, I feel like she is, if you haven't met her, she is one of the most nicest, down-to-earth people I've met. And, I would be bold to say that she's probably the current Mother Teresa on Guam and helping so many of the outreach community of here. So welcome to the channel.
Thank you, Doctor.
Yeah, so, you've done a lot here on Guam and you're a local as well. So, I always like to ask, what chose you or what made you choose this career in pharmacy and what is your ikigai and what are your plans now?
Well, I think God directed me to pharmacy because I've always wanted to help people. And I'm so glad that I was able to become a pharmacist because then I was given a lot of benefits and blessings through my career to be able to do what I do today and, to have the means to do it. Yeah, so I'm really, really grateful for the profession that I'm in. Healthcare has been good to me, being a provider, but also it gives me the ability to help my community. And I hope I can continue to do that.
Yeah.
Yeah.
So I know we talked about this a little bit earlier, but you said you had some goals and, and among being a pharmacist on site for Oka, like what kind of plans or what kind of goals did you have in mind going forward? And
well, ever since I came back home after pharmacy school, when I got back, I know that Guam had a very high population of diabetics. So my first concern was, what can I do as a healthcare provider or as a pharmacist to help the diabetic patient population here on Guam? And so I got actively involved with the Pharmacy Association and focused a lot just on diabetes. And then I realized, I said, there's more to this than just diabetes.
Yeah.
In order to help the community get healthier and stay healthy, you have to look at other aspects, not just medication management or therapy, but there are other aspects of daily living that we need to focus on. And that's to, help our community eat better, portion it better, be a bit more active, but then also work in a holistic approach, on a daily approach, lifestyle approach to get us to where they're at. No matter what your disease may be, it could be diabetes, it could be heart issues, it could be cholesterol, but it's somehow interrelated with our body and our systems that we have to think about it in many ways, and including stress management as well to help us with our overall health.
Right.
Yeah, and I want to do what I can to help my community. I'm a little peewee, but I'm willing to do what I can, to add to that, going toward a healthier community for this island.
Yeah. So I mean, when most people think of pharmacist, you know, the kind of the image you think is someone just
Inside
in the
the
pharmacy dispensing medications or
right, right.
pharmaceuticals. But you know, more than just saving my ass and getting me out of trouble, you know, when I make mistakes or if there are contraindications to meds or allergies or
Right,
you
right.
know, they keep me in check and make sure the patients. They save me a lot of times to make sure the patients are safe, right?
Right,
Because I
right.
don't know all the drug interactions and
Right,
things like
right.
that. So I've been helped a lot of times with pharmacists. But, you know, surprisingly, there's a huge scope that pharmacists do have that they can practice or they're more knowledgeable, having knowledge to work outside of just being in the pharmacy. And,
Right.
you know, I think education was a big thing on your list. And I think,
Yeah.
how are you helping people, or I guess what programs or what are you doing right now?
Well, there's a couple of things. In terms of pharmacy wise, I do preceptor for pharmacy students.
Yeah.
So I help them in becoming pharmacists, and especially I encourage community pharmacy, retail pharmacy,
Yeah.
and I do that at the pharmacy. And although we are the drug experts, I believe, like I said earlier, getting healthy and staying healthy has more to do with not just medication management, and and so I like to reach out to the community. I go to village outreaches, I go to workplace outreaches to try and use what little knowledge I have to instill upon others to kind of follow a healthier lifestyle, and to incorporate the various parts that can help them go toward a path that's healthier. And so whatever, if I'm not the expert, I don't know the answers, I try to network them with the resources that are available. And there's actually a lot available. People just don't know it, and they don't know how to go about to help themselves. Because in the end, I can't hold their hand every day.
Yeah.
I want to show them that it can happen and that there is help there. There are resources available that they can reach out to. But in the end, they have to be the one. We can only show them what could happen, but it's up to that individual to make that, adjustment or change in lifestyle and habits, to help them stay healthy, get healthy, and then live hopefully a good quality of life, and even if we teach them all that, if they cannot practice it in real life and just go nodding like this during class and then that's it, then, we can't do much about that. But at least to spread the word
Yeah.
that certain services are available. Like if you don't know how to eat properly, or what your portioning plate should look like, and stuff like that, or the timing of the medication could make a big difference, especially for blood pressure medicines. Whether you take it at 8 a.m. versus 9 p.m. I've had to do medication management for many patients throughout the years, and just adjusting time helped them with their therapy and to manage it better. Yeah.
Yeah. Yeah. So there's a lot of,
Yeah.
I think, pivots or different things pharmacists can do. Actually, one thing I'll kind of put out into the universe, and maybe are there resources already, but I think it'd be very helpful for pharmacists to almost put out this Bible or this kind of like this resource of for medications or even interactions with nutraceuticals. And because a lot of physicians, they don't know all the side effects or potential nutrient setbacks you can have, right? So for example, like with metformin, taking it long term, you kind of risk certain nutrition deficiencies like B12. If you're on a cholesterol medication like statins, you can decrease things like CoQ10, which you need
Yes,
for
yes,
energy production.
yes,
And I think a lot of physicians aren't really educated about that in residency. So having that resource or that person to educate, I think would be definitely helpful, because people, certainly have side effects from medications.
Yes,
So,
yes.
the good parts of medications, there's also some inherent, negative aspects. And I think education on how to deal with those negative aspects, I think would certainly be helpful. But there's something else that we were talking earlier that kind of perked my interest.
okay.
Something unique about you as a pharmacist doing it is you talked about community gardens and things like that. What was
Yes,
that about?
yeah. So currently, I am out in the community during
Yeah.
my days off, teaching students or any community member about self-measured blood pressure monitoring programs.
Right.
And so this year, I've been focusing a lot on heart disease and stroke prevention classes.
Right.
And so at the end of the class, I always get a raise of hands and say, "Hey, who wants to come join me in my community garden? I said, there's a country that offers little community plots to individuals, and so a lot of them will come and have their little cucumber farm or their tomato plot, and then we'll barter and share with each other the vegetables we grow and the fruits we harvest. Not only do you get the nutrition from the stuff we grow, but you're actually out there gardening. What does that mean? It's activity.
Yeah.
It's getting you to move and walk to your garden, to water your garden. So, it's not like you're working, and watching those things grow. It's just a joy, really.
Right.
Yeah.
And I mean, we don't really know if there is an actual direct correlation or what, and I don't know, we can even prove that in the study, but when you look at kind of the blue zones and the people that are living to hundreds, they kind of try to break down what are the common factors among a thing.
Correct.
And gardening is actually one of them.
Yes.
Right.
Yes,
so
yeah.
is it maybe just part of is it the activity of kind of bending over and squatting to farm, or is it the aspect of seeing life grow and kind of almost putting your heart into nature and being around nature? Is that the X factor of why people live so much longer? But gardening is it seems like there is a commonality in terms of longevity. So
yes,
hopefully you can teach me, because I don't have a green thumb. Everything I try to grow, I can't even keep hot peppers in check, and that's supposed to be the easiest thing to grow. So
I'm not a green thumb. That's why I turn to the experts for that.
Okay.
Yeah, and there are experts on Guam that are willing to help you. Yeah,
Right.
so we'll be back to your garden.
Yeah.
Yeah.
all right, I want some
I'm excited,
homemade vegetables.
Sounds good.
Yeah. So, we kind of talked about how you got into pharmacy, what you're trying to branch out to, and kind of maybe be outside of the scope. But I want to kind of get into some of the issues on Guam. It's not even specific to Guam. It's probably a nationwide or a worldwide thing. But, what are the issues on the people of Guam are facing in relation to access of pharmaceuticals, and whether it's back orders and ability to fill medications? Can you expand on that?
I think you can look at it as, is there a global shortage of certain meds? Is there a national shortage? Is there a local shortage? So there's multiple facets of it. It may not necessarily be that the item is short in stock or a national shortage.
Yeah.
It could be that maybe at one moment in time there's a market demand and the demand can't be met quick enough.
Yeah.
So, for example, like the case of Ozempic, Hollywood's taking all of it. So our diabetic patients on Guam can't get any, So it depends. But a lot of times, at least pharmacies locally, we can go quickly to the website to see what really truly is a national shortage. That way, if a provider calls and says, hey, how come my patients are having difficulty getting this? We can kind of look into it further to see, is it a temporary situation where our current vendor is out? And, on Guam, we order from the big three. Everybody orders from, the wholesaler 1, 2, 3, which are the top in the nation. And so we do have resources from all three. So I can't say that if it's a vendor issue, for example, my pharmacy, if our vendor is out, the pharmacy down the road orders from a different vendor. So that wouldn't be an issue if it's a vendor shortage, for the moment, for the short moment. If it's a national shortage, that's a different story. Yeah. And so if the demand is up for certain things, or there was a recall. One time, for example, when there was a Zantac recall and now no longer in the market because of, potential cancer and stuff like that. For the longest time, it was difficult to get certain things when there's a recall involved. And so that's nationwide. So it's not a local thing.
Yeah.
But when it comes to availability of medication, I don't believe we're in a unique situation. The only thing that would kind of hinder us from our counterparts, like in California, is how soon can we get it? Because they can get it in a day's time. They can get it the same day delivery.
Right.
We're just physically so far away geographically that it may take, anywhere from 3 to 5 to 7 to 10 days, depending on who's your vendor.
Yeah.
But other than that, we're in the same boat as the rest of our colleagues in the States, where if there's vendor issue, same issue. If it's a national shortage issue, same issue.
Yeah.
So when you ask the question of, how is the medication availability here on Guam, I think we are able to access medication properly. It's just a matter of certain things uniquely might happen for that moment. There should, like I said, vendor issues. It could be a national recall issue.
Yeah.
So do we have any issues about difficulty getting meds? I think it's the same for pretty much
Everybody.
the pharmacy, not just because we're so unique to Guam.
Yeah.
The only thing, like I said, was maybe a delay in shipment because we're so far away.
Yeah.
But other than that, we're in the same boat as our counterparts in the States. We may not have the buying power as big chains in the States, but that's another different story, different matter.
Yeah, because it's an issue. Like if people don't have access to insulin, that is super dangerous, right? So, is there any other like solution that can be done? Like I'm thinking the only way we can get out of this is to stockpile and have a big warehouse, but at the time that's also expensive to store all that medication, right?
That's why local pharmacies, if you're an owner, I feel for them because we have to stockpile. We cannot keep a week's worth. We have to keep a whole month's worth or 3 months, in fact, for some meds because we just don't know. You know, we have to kind of plan so we don't run out of meds. And it's difficult because just one medication could cost you $20,000, $30,000.
Yeah.
So can you afford to have 10 of those? That's like 2 houses, right? Or average of,
Well, not anymore now.
It can get difficult to stockpile
to
a
have
month
that much
to 3
inventory,
months.
right?
Yeah, so that is a big challenge for local pharmacies.
And on top of that, you're holding on to that much inventory of front costs.
Right.
And then is it the same deal for you guys? For you to get reimbursed by insurance companies, is that like a 60 plus days for you guys as well?
That's a little bit complex because every pharmacy negotiates their reimbursement.
Yeah.
We don't have a collective, group that takes care of it, so everybody on Guam gets the same reimbursement. That you do a one-to-one deal. There are, however, little groups that they call it Pharmacy Services Administrative Organizations. And an example would be, I don't know if you've heard of what's called the Good Neighbor Pharmacy.
Yeah.
So they kind of negotiate with the PBMs supposedly a better reimbursement if you're part of their group. But then you pay a fee. So you're like, okay, is it worth paying a fee monthly or yearly, whatever, for the GMP program? Am I really getting a good deal? I found out in the past that sometimes the negotiating power wasn't as powerful as we thought.
Right.
So some pharmacies locally opted for it at the beginning, but then they opted out later because they realized that it was beneficial financially to do a direct deal than to go through that program. So it's tough. It's a tough thing. And for us, I think the biggest challenge is that maybe we may get the same deal as the stateside counterparts, but our expenditures are higher. We have to pay for extra shipping costs.
Right.
Then we have to stockpile for 2-3 months, or a month to 3 months.
Yeah.
So it's a lot of costs. Yeah.
And going to costs, I think one of the most injustices out there is that a lot of our medications are produced by U.S. companies, right? So I believe even on Guam, we have the PAR local discount system, right? I think it would make sense that we as U.S. states or territories, I think it would make sense, just like anything, we give ourselves a good rate or a discount, but it's just the total opposite, where we charge ourselves, the U.S., the actual makers of these medications, more than we actually sell to other countries, which is absolutely ridiculous. So can you tell me about that? And then how come, for me, what would make sense is if we're selling to, say, the Philippines for X amount of dollars, $10 for a medication, why can't we, Guam, source out from the Philippines at their rate? Why can't we directly buy from the Philippines?
I think it's the same with a lot of items. Importation rules and regulations and laws dictate what we can or cannot bring in. And even if we're allowed to, there's a lot of sticky parts to requirements that you have to stick to in order to re-import certain things. It's not just medicine, but medicine definitely. Just for example, Many years ago, there was a company that made a branded drug that was made in the U.S. It was $5 a pill to buy it here. When you went to that country in Asia, it was 50 cents, tenfold, right? And so you're like, it's the same stuff. It's both brand. Why is it 50 cents there and $5 here? It's like, hello, you know? And so it's still the same situation right now. What was 20 years ago in that scenario is still happening today. And so that's why, I don't know if you've heard, but people in the boundaries of the northern U.S. part that's close to Canada.
Buy from Canada, yeah.
The residents take a bus
Right.
to Canada, buy their medicine, come back. But even that's a little sticky because there are rules of bringing in, even if it's for you, there are requirements that you have to meet in order to, bring your medicine back into the country as well.
Yeah.
So there's a lot of, statutes and laws and regulations that really hinder affordability of medication. And you're right, it's the big pharma because they dictate the price. And if they want to sell to us at $5 but 50 cents to an Asian country, we can't stop them. Yeah, I mean, maybe Congress can, but I know Karen Song can. Yeah, but it's a very concerning thing because drug prices are not going to go down; it's going up. Yeah, and so a lot of people in the higher end of the spectrum when it comes to economics, if they're in the higher status, maybe they can afford that $5 pill. Yeah. But what about Mr. Joe down the street who can't even put, rice on their dinner table, So they have to decide, am I going to take my blood pressure medicine by going to the pharmacy to get some for $5? Or am I going to put rice, food on the table for the kids? That's a big...
Yeah, that's a big conundrum to reality people have to face.
Yeah.
And also looking at drug prices, like... there's a huge range, I mean, sometimes it comes down to generic versus brand, but I just feel I'd say, can we say generally it might take 6 years or 8 years or something like that to go to the FDA and do all the
be off patent, you mean, to become generically available?
Or, no, just to research it and put it onto the market. You have to do through all the controlled studies and the research, right? And I don't know the exact figures, but on average, most, I guess, drugs have to go through this process, and it might take 6-7 years to get it to market, right?
Correct.
But why is there such a huge difference in blood pressure med costing $50 versus a chemotherapy drug costing, or immunosuppressant or immunotherapy costing $20,000, because it's probably going to take about the same time for the research. Why is there such a big variation in the drug costs?
Again, it's the big pharma. Yeah, because we don't dictate the prices.
Right.
The at least local pharmacies honestly don't have much say in the price.
Right.
We're like, take it as it is. If you don't want to sign up for a program at a penny a pill, forget you. Yeah. That's how the big insurance carriers will do it. And a lot of times we just take what they give. I mean, it's been difficult, but why is there such a big gap? Again, I have to put it on the ballpark of the big pharma. That's why I think that
do they price these based on just, this drug is expensive because maybe the volume you might not be able to sell. So to make back their money of all that time they put in research, it has to be 20,000 because maybe only 10 people really qualify or need it.
That's one of the factors for sure.
Okay.
Yeah. But even if there were a lot of people taking it, they're trying to recoup the money they invested into it for sure. So it's all about money and investment and return on investment.
Sure.
Yeah.
And I understand that, but I just don't. I can't fathom or understand. Yeah. I would imagine it takes about the same amount of resources or about the money to put all the drugs through trials and maybe in the research lab. I just don't understand why is it 10x for 20x versus probably almost the same process, right?
Yeah. So I think what needs to happen, and I don't know if this is a good example, this is the example I have. when Humulin first came out in the market, of course, it's available brand insulin, right?
Yeah.
And the company was selling it for, gosh, when I first started, I think it was like $7 a vial. Now I believe it's $130 a vial.
Wow.
And I'm like, whoa, you know? And so the only thing that happened in the last 2 years, I would say, is it took an act of Congress, I believe, and the administration to somehow talk to the big pharma and say, hey, you've recouped your money, bring it down now,
Yeah.
you know? And that's the only time they did it for 30 years. Because this was only 2 years ago that they brought down the prices. But before that, no matter how much pharmacies and pharmacists and other players would say, you know, it's just too expensive. It keeps climbing up so high, right? And so the little people down in the bottom of the totem pole couldn't do much. It took an act of Congress to bring insulin prices down. And that's just one of them. I do believe that there should be other drugs that should come down similarly. But what will it take? An act of Congress. That's what I think it is. It's not Big Pharma's not going to listen to Karen. Yeah. So I'm very grateful for that as a patient. I mean, I'm not a Democrat or Republican, or whatever, or swaying either way. But if it's meant to help the in the bottom end of it, the person that needs that insulin, and if it took an act of Congress to let them afford that at $10 versus $130, then I'm glad whoever did it. I'm thankful.
Right.
Yeah, and it's difficult because the biologics are really high up there right now, and I think that the only way that they'll be able to do that is just force it upon them to say, hey, you recouped your money enough. Come on, let it go now. You know, help these people because they can't extend their life without it.
Yeah.
You know, or live in misery because the symptoms are so painful. You know, I mean. Right? I mean, the biologics are just too high.
Yeah.
I think the next, administration should focus on biologics because they are ranging anywhere from 15 to about 50,000, 60,000.
Yeah.
Per treatment.
Per treatment.
Yeah. So
that's a lot. Yeah.
It's depressing. I just yeah.
Yeah, and we touched a little bit, or you kind of mentioned PBMs, right?
Yeah.
But can you talk a little bit about PBMs, or first, what is it? What is the acronym, and what are DIRs?
Okay.
What is the system, and how does this affect the landscape of retail pharmacies or independent pharmacies?
I was going to say, when you asked me this question, I said, Doc, I think we need another 30, 45-minute session, part 2 of this. But simply, I will just at least give you what the acronym is standing for. So PBM is Pharmacy Benefits Management Companies. Example would be like Elixir or Optum.
Right.
It's a national company. And then local insurances will utilize PBMs to manage their prescription programs.
Right.
And so that's what the PBM will do, is manage prescription filling for and reimbursement to pharmacies that are contracted and do that. Now, I was a bit confused about the DIR. Let me get this, because I had to also do a little bit of homework just to get all these acronyms, honestly. It says a direct and indirect remuneration. That's what that acronym is. And then according to what I saw, it was actually a CMS program to help so that prices for Medicare patients can come down. That was the intent or the goal.
Right.
But PBMs twisted it so both the pharmacy, independent, and the patient loses out. And here's a small example. I'm sure there are bigger examples, but the only thing I can think of is they use these quality measures or star ratings to use it as a way to take back money from pharmacies, and PBMs will do that. And here's kind of a question I had as a pharmacist at the pharmacy level. I said, hey, how come? Because when you transmit a claim, let's say the whole claim was $30
Yep.
and the patient's copay is $10.
Yep.
So that PBM is going to send you a check or ACH of $20, right?
Right.
But what was happening was the total was at $10, and then they were taking away from pharmacy minus $3, but then they want the patient to pay $13. We're like, what?
Yeah.
Does that make any sense at all?
Doesn't,
No. And that's where the DIRs are coming in, is they're doing some sort of take back kind of thing, and I don't know the full mechanism, but it is an issue because imagine that later on down the line when they pay us, they minus the $3, but the patient paid $13, but the whole thing was only, the value of it was $10. What is that?
Right.
Does that make any sense at all to an economist?
No.
Not to little me either. So you're like, what is going on here? And so that's why the question was, the Medicare patient, for example, they paid $13 when the actual value of that fill was $10. So why are they paying $13? Right? Isn't that a very confusing situation?
Right.
I'm like, what's going on here? But who gets the better of it? The PBMs. And a lot of I bet you a lot of local pharmacies kind of like shrug it off because a lot of times, what's $1, what's 1 penny to some big business, right? But when you add up all the pennies, 1,000,000 pennies is $1 million.
Yeah.
You know where I'm getting at, right?
Right.
So imagine that $3.
Yeah.
Right? If it's 3 million fills, who got the $3?
Yep.
The PBMs.
Right.
Isn't that something? And that all has to do with this DIR. I have to learn more about it, but there are some states that are currently fighting that situation or trying to do something about it. I have to, again, this is for another session, but I'll let you in on it for a little bit to pre-session.
Yeah.
So the federal solution was to propose in Congress what's called Improving Transparency and Accuracy in Medicare Part D Spending Act. They're trying to address this issue because their intent when they first came up with it was to save money for the Medicare Part D patient or Medicare patient, but in the end, that's not what's happening in reality.
More, yeah.
And it's affecting pharmacy. We're losing out, but then also the patients paying more, not less. And that was not the intent. And so the federal government is looking at it. I have to look at where they're at with that. And then stateside, because this is federal, stateside-wise, there are some states that are also doing something about it. So it says that, for example, Georgia, they prohibit a fee to be charged in regards to administration of fees by PBMs and does not allow patient copays to exceed certain level or allow for a clawback of the claim. And so that means the one I explained earlier, that $3, that's kind of like a clawback where they're taking the money back.
Yeah.
They make the patient pay $13, so $10 goes to the pharmacy, but they keep the $3.
Yeah.
So it's like, hello, who's making the $3? They are.
Yeah.
Right? So something's up, and some states have put in certain laws to not let that happen, and so they want to prohibit PBMs from doing such things when the intent by the CMS was not this. This was not the intent. It was to help patients, not hurt them more and have them pay more. It was to have save costs, and yeah.
Yeah.
Isn't this what?
Yeah. And
I'm like, what?
And I think that for me, I get worried about this kind of trend where at some point the retail independent pharmacies are going to get squeezed out of the market, right? And, do you think that's a possibility if things don't change? Because reimbursements for pharmacies are shrinking, like as a patient, right? I mean, I guess, can you explain a little bit of how does a PBM work with the pharmacist? Because I imagine, like as a patient, right? If I am directly working through the PBM and I get online medication or mail-in medication, mail order medications, right? And I have no copay, that's awesome to the patient, right? I mean, that's kind of almost a non-brainer to a patient, especially if you have to have 10 and they don't have to have a copay for each little single medication. It adds up. And I understand the patient's point of view, but then I think a lot of the in-touch services, and also it leads up to monopolies. And then we're stuck with PBMs decide what the price of the medications will cost, because there's no independent pharmacies to help offset or control or put a check and balance on that. So that's my worry as well.
Yeah. Like I said, Guam is so small compared to the continental U.S. So we're a little peewee here, and so no matter how loudly we shout, it really doesn't move the rock at all. And so it's a difficult challenge. Like I said earlier, for local pharmacies, when the reimbursements keep going, less and less, but then your expenditures to run that pharmacy are getting higher and higher, whether it's salaries or utilities, insurance, right? There's a lot of things that are involved. And so the margin or profitable margin has really come very, very thin. And so some have become a little bit creative in that they would balance it with having more OTC offerings or do other services such as immunization, for example. It's pretty tough for independent pharmacies, really, because you're a very, very tiny part of the whole healthcare system for the United States. And Guam is definitely small, and so it's hard to shout out to the stateside PBM and say, hey, don't pay me a penny when I bought it for 2 cents.
Yeah.
You can shout it. It's like shouting to a deaf ear, and it's not getting anywhere. And so people had to be a little bit creative and balance out so that they don't, lose out that much to where they can still continue to help their patients. And independents play a big role in the community. And, just like... And like doctors, do you like to Zoom with your doctor all the time? Yes, we had to do it at certain points for whatever public health reasons, but really we like in-person office visits, preferred to Zoom visits. I think a very few would enjoy that. Same goes with, medication management. Do you want to talk to someone on the phone about your side effects and, counseling through the phone or the Zoom? There's not build-up of provider to patient relationship that develops over the years. And I think any kind of patient care, you develop a relationship between the doctor or the pharmacist with the patient, and they have to trust that relationship. There has to be a trust, that they'll take care of me, they'll do the right thing, but then the provider's like, you'll be honest with me so I can help you. Don't keep things from me or whatever, And so how can we not have that in-person connection and develop that, provider-patient, relationship? I don't think it can occur 100% effectively if it's via mail order or via Zoom. There's a place and time for that maybe, but not all the time.
Right. Yeah. And definitely. Yeah. I also see the situations of where pharmacists can be a super direct advocate for you. Like just for one instance, say if I might change the dosage of the medication or there's a little bit more emergent medication that the patient needs at that time, that day, that hour.
Right.
Like good luck trying to get it mail order. Right. Yeah. If it's an antibiotic, you need it at that time, not mail order. Yeah. Or sometimes I might go off of Violin and I might not be able to fill the medication that exact 30-day mark, right? And sometimes pharmacies provide that advocate where they'll work with the insurance companies or work with the clinic to try get 10 pills or something until I come back or something like that. Yeah. And good luck trying to do that with the PBM. That's
well, not only that, when you do the mail order, I do understand the advantages of it. Even some of our staff will have their parents order mail order just because they're on like 5 different meds, 0 copay. It makes sense to them economically, so they'll order. But they have come across where the medicine was lost in the mail or didn't come on time. They have issues. And I feel for the patient because I wish that, I don't know how much the PBMs and the insurances are saving money, but I wish they would put us, the same level where, if they're going to reimburse the mail order, $10 and then at 0 copay, I wish they would offer that kind of program for the patients to get it from independents here,
Right.
local pharmacies.
Yeah.
Yeah, but again, it's a matter of when a mail order does 30,000 pills of filling a day, they apparently get it for less than maybe it's a minus a penny, maybe.
Yeah.
So to fill, right?
Yeah.
It doesn't cost them anything. Maybe that's why they're able to do that
Yeah.
and offer the zero copay. It's very challenging for independent pharmacies.
Yeah.
It is, yeah.
Yeah, and some days I just want to pull my hair out where like I write the prescription,
Yeah.
we fax it in, we confirm the fax was sent, and the patient or we say that, or the patient calls the PBM and says they never received the prescription. We send it again and confirm the fax, and it's kind of this cycle where like I know we sent it to you and they
And you
can't
even have
find
a
the prescription,
confirmation,
right? And that the whole time the patient is without meds for several days, and in the time zone. So that's my frustration with PBMs.
Yeah.
Um,
I think local, the advantages of again, like I said, we are a community. They are our friends and our neighbors. So I think we go that extra step and extra mile just because we care. I think that's the big difference between getting it from a robotic machine that filled it for you versus an actual person that wants to help you get better, wants to feel that and making sure that it's the right one. And then just say, hey, how you doing? And then they can talk to you about things and maybe they find out that you weren't quite taking it the right way or you had side effects you were kind of not telling anyone, but then in discussion with your local pharmacist, you find out, oh, that was a side effect I was feeling, that kind of conversation. And those can't occur with a PBM.
yeah, that's tough. Yeah.
Yeah.
Oh, so
Yeah.
we kind of alluded it to, with your ikigai, but I kind of want to get a pharmacist's point of view on how can we improve the healthcare system? How can we decrease all the comorbidities, all the heart attacks, strokes, diabetes? What's your perspective on what has to happen in the healthcare system or even in the community to improve the health of the population?
Yeah, so I think it's not a secret, but I think everybody has to get involved, whether it's private sector, public sector, whether it's government, whether it's the patient themselves. They need to all work together to not only help that particular patient, but also have certain programs that help the community toward a healthier community. And so it's going to take a lot of effort for sure.
Yeah.
But if we have the leadership of, for example, public health or the governor's office, I believe that private and public can work together toward a program that will help community health. It's not just about the patient's health, but rather the whole community. And I think there are some good organizations that are nonprofit that are working toward that. They're trying to get to the schools earlier, to the children, to help them drink less sugary drinks, or eat a healthier plate or have a healthier plate. And so everybody's doing their little thing here and there. I see snippets of activities and programs that are there, that are available, but it would be great to see a community effort that involves all aspects, including the child, including the parents, including the government, including nonprofits, just everybody. And I think that we need to kind of it's not just about medication therapy, it's not just about seeing the doctor, but rather a more holistic approach as to better daily living, and I know that one of the speakers at the conference I attended, I don't know if you were there, were you at the Loma Linda two-day conference? Okay. No. So I really liked it. I need to look further into it, and I would love to learn more from them because they wanted to do, because Loma Linda is is the only one blue zone in the United States.
Yep.
And so they said that daily lifestyle living is the way to go. And that means You don't need anything special. It's just a matter of, getting enough good rest, eating the proper nutrition, having a decent amount of activity daily, and managing, situations where stress can make things worse, not better. So there was a lot of things in lifestyle medicine, lifestyle, living that would help a community have a healthier, quality of life, and so that they can not develop into health issues. I think that's the way to go. And what will it take for the community to do that? That's something that the leaders of the community could come together with, whether it's the government or your church group or, or your own village mayor, for example. There could be community gardens at the mayor offices. I don't know.
Right.
But make sure it's gated, because there'll be a lot of scavengers coming to get your tomatoes that you work so hard for.
Right.
That's reality, right? Yeah. We've had people take breadfruit and mangoes, peppers. But I believe that to get Guam a little bit on the right track of becoming healthier, not being as heavy set, not having heart disease when they're 40, that's something preventable, or at least to kind of postpone it just a little bit by two decades. So I think we can work together. Doc, as a pharmacist, as a mother, as a community member, I would like to work with anybody and everybody willing to help our community become a healthier community. And there's a lot of good examples we can work with and look to toward, and so there's a lot of work involved, but I think it can happen if everybody had the same mindset that, instead of that potato chips, maybe I should have half a peach, right? I mean, stuff like that. So I believe that lifestyle modifications and daily living in the proper way, could help us have a healthier community. Sure. And
So you heard it from the pharmacist. It's not only the medications, and they are a valuable proponent of the healthcare system. But from what I hear, a big component that has to also be pushed is the education side. Also, it takes a village, it takes the community. We all work together to raise healthy people, right? So I value your efforts in, going out to the community. I only go to a few health fairs, but I think you're at almost every health fair out there on Guam, and you put your efforts in putting different programs. Yeah, maybe we got to set up this longevity blue zone pilot study and make a small community and make that a pilot study, and then and do that, right? And prove that it can be done on Guam. So
yes, I would love to see something like that come to fruition. Yes, definitely. Wow, I'm excited.
So we're nearing to the end. Is there anything else that you wanted to put out there? Any programs? Where can we find you? Any last messages out before we end?
Yeah, so for everybody that's listening, there is a group that formulated because of a need during post-COVID or during COVID, but the informal organization, the Guam Healthcare Providers Coalition, has stayed active, and that's who I participate with. Our pharmacy association also actively participates. So they are kind of like the central communication or group that keeps us in loop with all the different outreaches that are out there. And so I encourage all nonprofit health-related organizations to network with them, and so that we can do our part. There's a lot of work to be done, but I believe everybody has the same intention, is to get our community in the healthier situation. And so I appreciate everybody's help whenever there's a calling and you'll come out, whether it's the doctors, nurses, and all the volunteers, UOG. I mean, everybody's come out to pretty much a lot of these outreaches and done their part. I think if we have a more collaborative way to keep it going, the momentum, good things will happen. I do believe that we can attain a healthier community together. One of the things that I would like to see, though, is as I do these outreaches, I didn't realize, but food insecurity is a true issue here locally. I've been very blessed where I didn't have to think about is there going to be food on my table? But there are situations, here on the island where a child will go to an after-school program just so they could have a snack.
Yeah.
Because there's no food at home. And when they open up that fridge and there's nothing there, what healthy plate can they put, And so that's real, that's here on our island. And so not just about food, but about, the home environment, just the economy of things don't benefit them, especially the children. Sorry, I'm getting a little bit throat here. And so I want to encourage our leaders, whether it's in the government or in the medical field, let's put our strengths together, our wisdom together to make it a better community. Yeah, I think it can happen. I'm definitely hopeful.
I love the optimism. So yeah, let's go forward, and we got to keep pushing through to get everyone healthy.
Yes, and thank you, everybody. Really, I really, really thank you, everybody. Yeah.
All right. Well, thank you for your time. Thanks for visiting me.
Thank you.
Bye-bye.